Welcome to Crossroads of Health, where common sense and good science intersect, with your hosts Rick Simpson and Melanie Martorana. And now it's time for Crossroads of Health.
Good morning, and thank you for tuning in to Crossroads of Health, where common sense and good science intersect. Always real, always unscripted. I'm your host, Rick Simpson.
And I'm your co-host, Melanie Martorana. Now, Rick, can you give us some talking points for this week?
The talking points section, there were a couple other things last week that we had seen that we didn't have time to bring up, and it's regarding vitamin D. Vitamin D is a huge issue, and there have been studies on this for the last number of years on vitamin D in relation to cancer, in relation to heart disease, in relation to certainly bone-related issues. But there are a couple studies that came out, and one of the studies is titled Reduced Vitamin D Levels Linked to Type 1 Diabetes. Well, diabetes is the number 3 largest killer in this country to date, so that's obviously a significant issue. There's another study, prenatal vitamin D suggested as a MS preventive or multiple sclerosis preventive. That's another large issue in this country. And then there's another study showing vitamin D and its relation, how it's protective against bladder cancer. So vitamin D is a very, very significant issue. And all the multis that we have in the Emerald Laboratories line, they all have significant levels of the vitamin D. They have 1,000 IUs per serving, which is a healthy baseline dose. Now, I have mentioned to the listeners before that myself, Julie, my 2 children, we all go to Dr. Stengler's once a year and have our blood work done. And my blood work, the last 2 times we've done it, showed a suboptimal level of vitamin D. I personally consume 12,000 IUs of vitamin D per day. Now, I'm not suggesting that everybody should do that unless you have blood work that shows you need that level, but I work in an office most of the day, and we all need to be out in the sun in order to produce adequate levels of vitamin D. So most of us, or many of us, are not out in the sun every day. So that becomes very important to have adequate levels of this. But in the multi, at least you get that good starting baseline amount, and then, there's really very little toxicity with vitamin D. I'm not sure there are any toxicity studies. So even if you took, 2,000, 3,000, 4,000, I think you would be fine. But I do need to say you should consult with your physician if you're going to take higher levels. But it is a very, very important issue.
We do want to let you know where you can also find more information. Our website, www.ultralaboratories.com. You can also find us in your local health food store, Sprouts, a lot of your Whole Foods, other fine health food retailers. And then, of course, go to shopnaturalproducts.com.
Thank you so much for joining us, and we'll look forward to being with you next week for another episode of Crossroads of Health.